Welcome to this webinar on acne called Break Up with Your Breakouts. Hi, I'm Dr. Priyanka Reddy and here are 5 reasons why I have curated this free acne webinar called Break Up with Your Breakouts for you guys suffering with acne. Number 1, delaying the treatment, which is as common as the problem in itself, leading to some permanent acne aftermaths like acne marks and acne scars which are very difficult to treat. Number 2, seeking advice from wrong people who have no experience or expertise in treating acne like family and friends. Number 3, misinformation about acne by self-proclaimed skincare experts or influencers. Which leads to the 4th reason of me making this webinar is self-medication. With self-medication, which has become very common these days, you end up using wrong products or the right products in a wrong way, which is very detrimental to your skin's health, leaving your skin sensitive or sometimes even with permanent side effects. Number 5, home remedies. Most of us would have tried these at some point, right? But trust me, those toothpaste, garlic is never going to treat your acne. It is ineffective and can end up making your skin sensitive and leave you with PIH, which is the marks on your skin. I felt the root cause for all of this is lack of proper knowledge and guidance on acne, which is why I curated this webinar for you guys so you can now be empowered with knowledge on acne and can take informed decisions to seek the right help with the right person at the right time. Watch the webinar till the end to get one step closer to achieving an acne-free skin. So now let me explain the reasons, taking the examples of my actual patients' case studies. Number 1, acne delayed is acne worsen. This is a patient of mine who's 28 years old. He came to me in distress because he was really bothered due to his post-acne scarring. Now, he had acne since he was a teenager. At the beginning, he was not really worried about it. But as he kept growing and as the acne kept becoming severe, he wanted to seek treatment. But he was told by his family and friends that acne is a very common scenario and that it would come down on its own as he grows older. But as he kept growing older, the acne only kept getting worse. And again, when he wanted to seek treatment, his family and friends suggested some over-the-counter medications and self-medication scenario was going on for a couple of years. Now, finally at 28, when he wants to take treatment, he's left with severe acne scarring, and even with the best treatment modalities in the world, we can treat his acne scarring and give him improvement by about 70 to 80%. If anyone promises to otherwise and say they can treat your acne scars by 100%, you know that they're not being 100% honest with you. Moral of the story, timely treatment of acne is very important to avoid acne aftermaths like post-inflammatory hyperpigmentation, post-inflammatory erythema, and the most concerning problem, post-acne scarring. So the next reasons, misinformation by self-proclaimed skincare experts, seeking advice from wrong people who have no expertise or experience in treating acne, and self-medication. I will be talking about these 3, giving 1 or 2 examples because there's usually an overlap in these scenarios. With social media becoming super accessible to everyone and almost any information being available with just tap of a finger, everybody is tending to think that they can treat their skin problems on their own. Now, I see patients coming to me with knowledge on different kinds of actives. Like they come to me now saying, Doctor, I've been using salicylic acid, I've been using niacinamide, I've been using benzoyl peroxide, and this was not the scenario even just 3 to 4 years ago. I think post-lockdown with excess consumption of information, people are tending to take a lot more care of their skin, but they're not understanding the difference between using a cosmetic product and a medicated product on their own. This is a patient of mine who is 33 years old. He has occasional acne breakouts, nothing severe. He thought he can treat and better his skin himself. He's been following some skincare influencers and he understood that using benzoyl peroxide and salicylic acid is good for his acne-prone skin. So he's been using benzoyl peroxide every night on his cheek area for 15 to 20 days. He's also used salicylic acid 2 to 3 times during this period for exfoliation. And as you can see, he ended up having skin sensitivity. So what happened here? By using too strong actives in a way they're not supposed to be used, disrupted his skin barrier. So it is very important to understand, not just understand the ingredients that can be used for a particular concern, but also to understand how to layer them, how to use them the right way. So it's always about setting up a proper skincare routine without disrupting the health of your skin. And this comes with experience and expertise, which is why it is very important for you to consult a board-certified dermatologist, especially when you're beginning your journey of skincare, and all the more when you are wanting to treat a particular concern. It is important for you to set up a good skincare routine, have short-term and long-term goals. So this is a patient of mine who is 25 years old, who has been buying over-the-counter medications that contain steroids, thinking it will put a stop to her acne. What has happened, as you can see, the skin has become extremely sensitive. It is red. You can see the tiny blood vessels that are appearing on the skin. These are called telangiectasias. Extreme photosensitivity. She's been using this over-the-counter medication for over 3 to 4 months, which led to this condition. She's in extreme pain and agony because she's not able to tolerate a little bit of sun exposure, light exposure, or even when the fan air touches the skin, it is extremely painful. So this can happen when you have overexposed your skin to powerful steroids. And here you can see another patient of mine who has purging because of wrongful use of medications, again taking suggestions from the social media. So these are just some of the case scenarios that I'm sharing with you, showing and trying to emphasize the importance of a proper skincare routine and a proper approach to treating any concern that you have. And next comes home remedies. Now we all at some point, like I've already mentioned, would have tried some of the other home remedies to treat our skin and hair concerns. The commonest in acne being usage of lemon, usage of baking sodas, toothpaste and whatnot to treat your acne. Now all these ingredients will disrupt the skin's pH, leading to skin sensitivity, can dry your skin out, leading to chemical burns, redness and post-inflammatory hyperpigmentation is a very common scenario, especially for people applying garlic and lemon on the skin to treat their acne. So this is a patient of mine who is 16 years old who came to me with post-inflammatory hyperpigmentation just because she's applied garlic and lemon on the skin for about 15 to 20 days continuously to treat her acne. All of this is happening because of lack of proper guidance, lack of proper knowledge to take treatment for acne and address it the right way, which is why I'm creating this webinar for you guys to have a full understanding of what acne is and to motivate you to take the necessary steps. So let's begin with understanding what acne is and how it is caused. The main characters in the story of acne are the hair and oil glands. So first let's look at what's normal so we can understand what's not. So normally the oil glands or the sebaceous glands that are present here attached to the hair follicle will secrete oil that helps in keeping the hair and the skin lubricated. So they secrete oil, it travels this way and comes to the skin surface. Now this is normal functioning. And then there are dead skin cells, like how our skin sheds dead skin cells once in 28 days and is replaced by new skin cells. The hair shaft also sheds the skin cells that travel all the way up, mixes with the oil, travel up and through the follicular opening they come out onto the skin and are expelled. So this is normal. Once in 28 days the dead skin cells being shed, the oils that are being secreted by the oil glands come up, travel and come out through the skin. Now in cases of acne, number one, there is increase in the oil production by the oil glands or the sebaceous glands. There is increase in production of the sebum, right? So there is more amount of oil that is being produced than it can be excreted. Number one. Number two, in some cases of acne, there is a substance called keratin that is produced by the hair shaft normally, which tends to be produced more. So when this keratin is also produced in excess, this mixes up with the dead skin cells, makes it a sticky substance, and thereby the dead skin cells cannot be easily excreted outside. So there is a sticky substance here because of accumulation of the dead skin cells. Now what happens when this dead skin cells and the oils together are mixed? It forms a plug. So the dead skin cells, the oils and the keratin is becoming like a plug here. Okay. So now this plug is restricting the movement of any of the substances on the outside, forming a bump. So that is the formation of acne. Now here, what we commonly hear as whiteheads, right? Whiteheads. These are skin colored bumps that are just raised above the surface. Now when this plug, right, is here and is pushing the skin out and forming a white color bump, this is called as a whitehead. So this is a closed comedon, also called as a closed comedon, where the skin is still intact and it is just pushing out of the skin surface. This is called as a whitehead. And now when there is opening of the skin here and it is exposed to the air outside, it gets oxidized and it forms a black color plug, which is called as a blackhead or an open comedon. Okay, so till now there is only oils and dead skin cells in that plug, which means there is no infection as yet. There is only mild inflammation, if at all anything. Now, when there is this inflammation that is going on, and there is whiteheads and blackheads, this is mild acne, all right. Now, when there is normal bacteria that is present on the skin cells, right? So when there is too much of oil present here, the bacteria also tends to thrive in this kind of environment, and there is the entry of bacteria in this picture. Now when there is little bit of bacteria, there is inflammation. That is when you see those little red color bumps on the skin, little red. So that is called as a pustule. So you have whiteheads, that is the closed comedons, that is just skin colored bumps. When they get exposed, when there is a little tear in the skin and they get exposed to the air, that is called as a blackhead or an open comedon. And when there is bacteria, that is a normal commensal on the skin, tends to thrive in this anaerobic environment. It just loves that kind of environment. It becomes a breeding area. Then there is more bacteria there, making it red, angry looking acne, leading to those red bumps called as pustule. And when there is this inflammation happening, we have soldiers in our body called white blood cells, right? Now they come rushing. The white blood cells tend to come when there is, let me draw a clearer picture for you. So when there is so much of accumulation of the dead skin cells, oils, and now there is entry of bacteria as well, this tends to give away. When this particular buildup tends to give away, then the white blood cells also will tend to come here to protect the skin, right? Now this is when you see those big angry looking acne along with little bit of pus. This is the white blood cells coming in and trying to control the situation. So you now tend to see little bit of pus-filled acne as well. These are again called pustules. And when it becomes more severe, this is called as cystic acne, when it becomes more in number and also size, and those acne don't tend to go for a long period of time because there's a lot of infection under the skin. So we have seen whiteheads, blackheads, pustules, and in severe cases you have cystic acne. Doctor, why do I get acne? Let's get into the causes. Now, the most commonest cause, of course, for long-standing chronic acne is genetics. So if you are prone to have acne genetically, no matter what you do and what you don't do, you will get acne. And of course, the severity and the aftermath of acne will depend upon the care you take, the treatments you take. The other common cause is hormones, hormonal fluctuations. So you notice that you tend to get acne once you hit puberty, right? So that is because of the hormones that are being secreted that will stimulate the oil glands to produce more oils. So hormonal fluctuations around your puberty, during your pregnancy, that's the next important cause. And then you have diet, highly underestimated cause. The diet, impact of diet is huge on acne. There is enough research proving sugary foods, milk or milk products, refined carbohydrates causing stimulation of acne. Medications, when you are on oral contraceptive pills or taking steroids, it can tend to trigger acne. Cosmetics, like we've already discussed a while ago, this is because of external factors. You know, when the cosmetics that you're applying is blocking or clogging the pores and not letting the oil free outflow, it can lead to acne. And then you have environmental pollutants and habits. Now, what are the habits that we're talking about? Not washing your face properly at regular intervals, not changing pillowcases, not treating your dandruff. Again, habits will also include your diet. Stress. There is not enough evidence, stating that stress can cause acne directly, but stress can release hormones like cortisol, which are again sebogenic, which means they stimulate the oil glands to produce more oils. So stress is also another factor that can cause your acne. So now let's get into the treatment of acne. If you can see here, I've written multifactorial and multimodality. What do I mean by this? Multifactorial, by now we understand that acne is caused because of more than one factor, right? So there's dead skin cells, there's bacteria, we've been through this. Because there are multiple reasons for acne, we also need a multimodality approach, meaning we need more than one ingredient or one procedure to treat the acne successfully, depending on the type and severity of the acne. So if you want to broadly classify the types of ingredients that go into acne, we can look at antibacterials. If at all the acne has bacterial component to it, if there is infection, right? We need antibacterials like a benzyl peroxide, clindamycin, and if the condition is very severe, meaning there is a lot of pus and it is topical treatment is just not enough, then we will also rely on oral antibiotics in case of pus-filled acne. So this will help in clearing up the bacteria. But the first step is, because there is clogging of pores, what do we need? We need exfoliants like salicylic acid. Now salicylic acid is a beta hydroxy acid that helps in regulating the oils, that reduces the sebum production and helps in clearing up the superficial dead skin cells, thereby unclogging the pores, which is the most important step in treating acne. So we need ingredients like salicylic acid. Now we do have alpha hydroxy acids like glycolic acid and lactic acid, which are much more milder, but these are preferable for people having dry skin or sensitive skin, and for oily skin individuals it's important for us to address oil, which is why salicylic acid plays a much more important role in treating acne compared to the other alpha hydroxy acids. So we have antibiotics, we have exfoliants like salicylic acid, and we do have other ingredients, say for example like niacinamide. Now niacinamide is an ingredient that does a lot of things, a little bit of lot of things. So it helps in regularizing oils. It has a little bit of anti-inflammatory property as well. So this is also, so it's not very effective as a standalone, but we usually combine it with other ingredients to take the benefits of niacinamide. We have ingredients like azelaic acid that again has a little bit of anti-inflammatory properties, but I prefer azelaic acid as an ingredient for treating post-acne erythema. It is effective in treating post-acne erythema than just active acne. And then vitamin C. Now vitamin C is a very controversial molecule when we want to treat acne. I personally do not prefer giving vitamin C to people having sensitive skin and acne prone skin, especially when you have active acne episode. So once we treat your active acne and your skin barrier is intact and your skin is more healthy, and if you have a lot of sun exposure, or when we feel that you have oxidative stress going on and also some pigmentation concerns along with it, that is when we bring vitamin C into the picture. But when you have active acne, steering away from vitamin C is a good idea. Next is a sunscreen and moisturizer. Right, so sunscreen, any treatment, whenever we want to treat any concern or even just build up a basic skincare routine, the protocol is incomplete without a sunscreen. So look for, when you are looking for sunscreens and moisturizers, look for products that say non-comedogenic, oil-free, lightweight, water-based. These are the terms that you should be looking out on a product when you want to set up a skincare routine for oily, acne-prone skin, right? So you don't want any of the products that you're using to further clog your pore. If at all, they should be unclogging the pores but not clogging the pores, right? So even your sunscreen that you use, the moisturizer, this is the biggest myth going on, that oh, I have oily skin so I don't need a moisturizer, right? So I've made enough content on this on my YouTube and Instagram handles as well. Oily skin is not equal to a hydrated skin, right? If your skin is dry, it triggers your skin oil glands to produce more and more oil, making it more oily and leading to further breakouts. So hydration is different from oily skin. So you definitely need a moisturizer. Again, look for water-based, lightweight, non-greasy, non-comedogenic, the terms that you should be looking out for. So the basic for anybody, acne, no acne, teenager, adult, old person, anybody require at least 3 basic products, that is a face wash or a cleanser, sunscreen and moisturizer. And now all the other actives will be adding based on the concerns that you have and your skin goals, right? So you need a face wash, a sunscreen and a moisturizer. Along with these ingredients will help in putting the acne under control. Now in a face wash, what I recommend is go in with 2 face washes. One, a gentle or a mild face wash for the morning, because at night your skin has a little bit of oil secretion but it's not getting exposed to pollutants, or there's not too much oil there. So you can just wash your face with gentle cleanser in the morning. And coming to evening, by then there's a lot of oils, the skincare products that you've applied in the morning tend to build up, and the pollutants, all of that tends to build and clog the pores. So you need a face wash, preferably a salicylic acid based face wash that helps in clearing up all this build up, unclogging the pores and also controlling the oils. This is something that is the routinely prescribed. But you have extremely oily skin, then using a face wash that also has a little bit of alpha or beta hydroxy acid in the morning is also okay, but you have to see if it is suiting your skin. You don't want your skin to become extremely sensitive by the end of the protocols, right? So you need to have a gentle cleanser in the morning and a salicylic acid based face wash in the evening, and you have to use a sunscreen in the morning and moisturizer morning and night depending on how dry or oily your skin is. And some of these actives will tend to come into picture depending on the kind of acne you have. Next, we have retinoids or vitamin A derivatives. They are, you must have heard of adapalene, tretinoin. These are super effective ingredients in treating acne at the same time, super powerful, and can lead to skin sensitivity if you don't use it the right way, which is why it is not recommended for you to self-medicate these kind of products, and you always have to take the guidance of dermatologist. So these retinoids work by, it does a lot of things in treating acne and addresses most of the concerns, like they reduce the inflammation, they reduce the oil production, they also work in improving the skin cell turnover, therefore preventing the clogging and also reducing the inflammation. So they do a lot of things. You can also get combination of these products, right? You have adapalene in combination with clindamycin or adapalene and benzyl peroxide. So these are all combinations of super active ingredients, which means you have to be very diligently using them. And we see a lot of times people coming to us with skin sensitivities. We've already shown you a patient when in the previous discussion, right, that how he ended up with skin sensitivity after using benzyl peroxide for an extended period of time. So what happens is there are two things that can happen when you wrongfully use the products. One is either you are using them for longer periods of time, which can lead to resistance, and you're using too much quantity, which can lead to skin sensitivity, both of which is very detrimental to your skin's health. So once the products develop resistance, your acne will not respond to these kind of ingredients. So it's important for you to understand how to use them. Like I said, sometimes we give them a spot application, which means you apply it only on your acne, and sometimes we ask you to use it on the entire affected area. Everything depends upon the severity, your skin type, and the ingredient that goes into the skincare protocol. So you can get combinations of all these medications. Definitely not recommended for using long periods of time, like months together. We see patients coming to us using these products for 3 months, 6 months straight, and of course they don't find any results because by then their resistance would have developed. Just topicals is enough if you have mild acne, when there's not much of infection or inflammation. Just the topicals would be enough. And so this is the daily protocol, and weekly what we recommend you do is to do in some exfoliants. So using salicylic acid exfoliation 1 to 2 times a week will also be helpful in unclogging the pores. Now when you have severe acne, moderate to severe acne, that means there are a lot of pustules, you have infection, and you have some resistant acne that is not responding to the topical medications, is when we also take the help of oral medications, right? So before I go there, there's something important also we need to cover about the benzyl peroxide and clindamycin using on top of your skin as topicals, right? So this is something that is commonly prescribed. You must have also heard about this a lot on social medias platforms, and I see that a lot of patients are buying and using it on their own. But mind you, these are antibiotics, and using it for a long time on the entire area of the face is going to develop resistance and not going to work on your acne for longer periods of time. So you need to understand how to use them. Sometimes we advise you to be using it as spot application only on the area that's affected. Sometimes when you have a bigger area that is covered with acne, we ask you to apply it on the entire area, but there is a specific way of application and there's a specific duration that you need to follow, and you can't be applying it for months together. So always consult your dermatologist, where even when you think okay, benzyl peroxide is very commonly spoken about, maybe it's not or what do you say, a medication that causes serious side effects. It does. It can lead to sensitivity. I've also shown you the picture of one of my patients in the discussion that we had early on. So it can lead to skin sensitivity if you don't use it the right way, and if you use it for long term, it can lead to resistance. So always be sure of how you're using it and for how long you're using it. So yeah, so that's about the topical applications. And then when the concern is severe, like you have moderate to severe acne, when you have a lot of pus and a lot of inflammation, and topicals won't suffice, that is when we go to oral medications. So again, we have isotretinoin, which is a vitamin A derivative. Like mentioned about the retinoids here, it does improve skin cell turnover, reduce inflammation, reduce the oils. It is something that we give in moderate to severe acne. And then we have anti-androgens that helps in fighting the excess testosterone causing acne, hormonal therapy using oral contraceptive pills, spironolactone, and antibiotics. When you have severe pustule cystic acne, we tend to give oral antibiotics to reduce the overall infection and then treat with other modalities as well. But antibiotics also have a role in treating acne. And then you have supplements. Giving oral supplements like omega-3 fatty acids or zinc will also help in reducing the inflammation, building the skin's immunity, and just improving the overall well-being. So supplements are also given in some cases. And then we have injections like steroid injections. So this is not commonly done when you have the 1 or 2 acne that are super resistant, not responding to topicals, and then you don't have too much of acne that we can put you on orals. That is when we rely on steroids to make sure that the acne is not sitting on your skin for longer periods of time, because that can lead to acne aftermaths like PIH or acne scarring that we've already discussed. So we don't want the scarring to happen. So, and also sometimes it's very painful that the patient feels very uncomfortable and is in pain. So that's when we give the steroid to immediately reduce the severity of the concern. And there are also acne patches which are catching up of late. So acne patches, again, this is not like they're not medicated, they're just patches that helps in shielding your acne. So what we ask you to do is, if you have those 1 or 2 acne and you want it to a faster remission, then we ask you to apply an ointment and then put the acne patch over it. So what it does is, 1, it helps in better absorption of the product, number 1. Number 2, it also prevents you from popping that acne. A lot of times we tend to like pick on that acne, so it helps in providing a barrier so that you don't pick your acne and worsen the condition. So acne patches that way also definitely help, they're harmless. And then the procedures. Now, it is do not shy away from procedures. Whenever patients come, they say, oh doctor, but I don't want to get procedure done. So what happens is, the peel, especially when we do the procedures, there are different kinds of treatments, but for active acne it's mostly the chemical peels. Now these chemical peels will contain higher concentration of these topical applications that we tend to give you, like they can have retinol, they can have salicylic acid, glycolic acid sometimes. So it depends on what type of acne you have, and most of the times it's all combination of all of these ingredients. You know, there is black pill that has a lot of ingredients in it that helps in treating acne, so on and so forth. So peels will help in faster remission, they help in exfoliating the skin, reducing the inflammation, and much faster remission can happen when you do the peels. This is again to make sure that your acne is not sitting on your skin for longer periods of time, to avoid acne aftermaths. So please don't shy away from procedures, they are harmless, and if they have major side effects or if they're harmful, the doctor wouldn't be suggesting it to you in the first place, right? So peels will definitely help in faster remission. Then there is light therapy, red light therapy, that again helps in reducing the active acne. So these 2 procedures mostly are for active acne. Peels can also help in reducing the acne pigmentation as well. And then you have lasers. Now lasers mostly are for the acne aftermaths, like pigmentation and scarring. So we have lasers like Q-switch laser that helps in tackling the post-acne pigmentation. We have IPL laser that helps in tackling the post-acne erythema. And then we have CO2 laser, microneedling RF, derma rolling. All of these technologies help in treating acne scarring. Well, you're getting on a good skincare routine, you're being super consistent with it, but all of that will fall flat if you don't adapt to certain lifestyle changes. And what do I mean by that? Number 1 on the list is your diet. Yes, diet can worsen or trigger your acne. There is enough studies and research proving that certain food items, say like sugary foods, highly processed fried foods, milk and milk products, can trigger and worsen your acne because they are sebogenic, which means they trigger the oil glands to produce more oils, worsening your acne. So if you are still consuming any of this when you have active acne, severe active acne especially, it's high time you change your diet to foods that are antioxidant rich. Right? The other changes, like it could be as simple as a face wash. It is highly recommended that people with oily skin or acne prone skin wash your face at least twice a day. Gentle cleanser in the morning, as we already discussed, and a salicylic acid based cleanser in the evening. 2 to 3 times a week or all the days in a week, depends on how severely oily or acne prone your skin is. But if you don't do this, if you're skipping especially the evening face wash, you skip, the pores are clogged, your acne is worsened. As simple as that. And again, changing your pillowcases. Now you're transferring the bacteria, the red skin cells, all the dirt and grim that is on your skin to the pillowcases, and you don't change them at regular intervals, it's all going back into your pores. And that's a vicious cycle that keeps developing this. So change your sheets at regular intervals. Very important point. If you're somebody who's into sports or gym, working out a lot and you sweat a lot, you come back and take shower immediately, right? So acne is not just on face, right? It is there on your back, it is there on your shoulders, arms, chest areas. All of these areas which have follicular openings, prone to friction, accumulation of sweat, dust, can all have acne on that particular part. So if you do not shower immediately after your workout, the sweat and the dust that is being accumulated can clog the pores and worsen your acne. And if you're playing sport also, it's the same thing. You come back and take a bath immediately without any delay. It's a common practice that you go to gym, come back, and then have your breakfast, relax for a little bit, scroll through the social media or read your newspapers. This is a very common pattern which can worsen your acne, especially the back acne. All right. And then the other lifestyle modifications like stress. Stress can release hormones like cortisol, which again is sebogenic, which means it'll trigger the oily glands to produce more oils. So stress management, regularizing your sleep cycle is again very, very important. Again, I commonly see that people like teenagers, they're not very conscious about their acne while it is happening during the teenage, because they're not really aware about it or about the consequences of acne. So then they tend to take it very easy during those years, but then later they come back being very upset about how they've handled their acne, and they always say that, oh, had I known, I would have managed my acne better. Because now they're having post-acne marks and scarring, right? So it's important that even if you're a teenager or if you are a parent of a teenager, do not think acne is a very simple concern that can go away. Unless you're a child or you have 1 or 2 acne here and there, that's totally okay. But if you have genetically acne prone skin, you're getting a lot of acne as a teenager, please make sure that you address it at the earliest. It doesn't mean that you have to be using 10 odd products or doing a lot of procedures in the clinic. Simple skincare routine to make sure that the oils is controlled well, and making you understand the importance of managing acne early on will help in tackling the problem in the future. The other common thing is popping. I'm sure most of you at some point in your life are still popping your active acne. What is happening? I mean, I'm sure it could be very gratifying for you to do that, and also some of you might be thinking or assuming that your acne will disappear sooner if you do that. One, you're spreading the infection by doing popping your acne, and two, when you pop your acne, there are high chances that it can lead to pigmentation and scarring as well. So please do not pop your pimple. Apply the ointments that we have given you as spot applications to be applied on the active acne, and if you're just not able to resist popping it, then your acne patches will come into the picture. They can help in forming the barrier, as I've already explained. So please do not pop your pimples. The next important aspect is clothing. Now, when you have acne, there is inflammation. It's very important for you to wear skin-friendly fabrics that helps in absorbing the sweat. So if you're wearing synthetic fabrics, that can only cause more friction and worsen the problem. So wear skin-friendly fabrics like cotton that helps in absorbing the sweat, and also do not cause more friction, especially on the back area, to reduce it. This is very important, especially if you have back acne. The other aspect is dandruff. If you have dandruff on the scalp, you are more likely to get forehead acne. So it's important for you to treat your dandruff. And again, this brings me to another point of helmet care. So if you have dandruff and you're wearing helmet, driving two-wheeler, it's important for you to take care of helmet and the hygiene of the helmet as well. So always use a cotton cloth on the scalp and then put on your helmet. This way you're not transferring the dandruff, the oils, the dirt from the scalp to the helmet, so that it doesn't again become a vicious cycle wherein the dirt and rim from the helmet is being transferred back to your scalp and vice versa. So always make sure that you cover your scalp with a clean cotton cloth, put it for wash every single day. Also sun dry your helmet once in a while. Maintain that helmet hygiene, maintain scalp hygiene, which will also help in addressing your acne. Well, that's about the treatment of acne. So it's very important for us to look at all the aspects of acne, treat not just with medications but also understand the internal health and treat accordingly. So it's important for you to consult your dermatologist to get any sort of treatment. And once you're there, please be consistent with your skincare routine and understand that it is a long-term game and not short-term. Also, one last piece of important information about acne I want to convey to you guys before I end this webinar, so that you can have realistic expectations out of your treatment, is that it is not possible for you to have acne-free skin all the time and forever. Acne cannot be cured. It can be treated and put under control very well. And what do I mean by this? That you can have one or odd acne here and there around your periods, when you travel to humid climate, or even when you're doing your best to keep your acne under control, you can still have one or two breakouts that can happen because you have acne prone skin. This is normal and this is something that we have to be accepting of. But then why do we take treatment? Because we want to reduce the severity of acne to reduce the time the acne is sitting on your skin, so that the acne aftermaths like your PIH, PI or acne scarring is not gonna happen. The goal of the treatment is to make you be confident in your own skin and to reduce the embarrassment that acne is giving to you guys. So having realistic expectations is very important, else you will be left disappointed even with the best treatments being given to you. So I urge all of you to take necessary steps. Stay safe, don't indulge in self-medication, and do not cause more harm to your skin. Stay healthy and stay happy. If you wish to take one-on-one consultation with me, you can click the link that's attached. We provide both online and in-person consultations. And I am all about holistic approach. It's not just about giving you some medications you can apply or intake, but it's also about digging deep into the lifestyle that you are leading, looking into your diet, your sleep pattern, and other aspects that could probably affecting this concern, and advising necessary changes. So with the consultation, you'll also be getting a diet chart that you need to be following in order to keep your acne under control. So it's always about holistic approach, because I strongly believe that the skin and hair are external manifestations of internal health, and we need to constantly keep a check on internal health so we look beautiful and glowing on the outside.